Good afternoon, everyone. We appreciate you spending your lunch hour or somewhere around that time with us this afternoon. My name is Alyssa Scarciotti. I'm the head of education here at Lexier Dental Group. Looking forward to the presentation that we have for the next hour. I want to introduce our speaker, Tori McCraw. Tori is our senior manager of iOS adoption here at Lexier Dental Group. She is certainly our expert on all things digital. So you guys are in for a treat with her presentation this afternoon. And then we also have supporting her, we have Emily Geisey. Emily is a territory manager and an iOS clinical specialist here at Lexier Dental Group. So she'll be helping to just chime in with any questions or manage the chat. If you guys do have questions, feel free to use the chat feature. We will be looking at that throughout the presentation. If it makes sense, we'll interrupt and have Tori answer, or we'll certainly be answering questions and have Q&A at the end of the program. One last thing, just in terms of your CE credits, we usually like to get those out within a week. So those will be coming via email from me within 7 days. So without further ado, I'll kick it off to Tori and let us know if you have any questions throughout.
Awesome. Thank you, Alyssa. Welcome, everyone. Good afternoon. Thank you so much for spending your lunch hour with us, like Alyssa mentioned. This is the first of many webinars we will be doing on scanning. So looking forward to this series. So thank you again for being here. We're going to go ahead and get started. And I'm just first going to dive into an agenda so everybody knows what to expect throughout the duration of this hour. We're just going to start off with a few slides in the PowerPoint that I've created for today, just to kind of prepare us when we get to this live scan segment of the webinar. So first, we're going to start with the preparation for a scan. How do you prepare yourself? What does that look like? And how to get set up for success? Then we're going to dive into the iTero software and home screen. So today we are going to be focusing on the iTero scanner, but maybe later on in the series, we may have some other platforms that we're going to focus on just to kind of talk through those workflows. As most of you probably know, other scanners have a couple different differences, and we want to make sure that we're focusing on the one that you're currently using. So we'll talk through the home screen of the iTero. Then we're going to go through how to upload images. This is a new iTero feature, which I think is extremely important, especially for any scan. You can now combine those images with the same file. Then we're going to cover some tips for full arch scanning. We are going to break and do a live scan. So I will switch between PowerPoint, go on to the scanner software on my computer, and then we'll break back and come to the PowerPoint, and we'll do some review of some live full arch scans that we've received here at Lexier. So moving on into preparing for the scan, as I mentioned, this is extremely important as you're getting set up. You want to make sure that your scanner can fit in the operatory, obviously, positioned comfortably in front of you. You don't want to be turning your neck to look at the screen. You really want to make sure that that scanner is positioned in front, it's comfortable, and you can see the screen as you are scanning. The next thing that's really important is the lighting. So lighting is one of the things I think, you don't really think much about, but you might have that overhead light over the patient. Maybe you were doing, your hygiene, or you're prepping a crown, whatever the case may be, you've got that overhead light. Doctors may have their loops on. So you really want to make sure you don't have any additional loops as you are scanning. Most intraoral platforms, they do have the correct amount of lighting that is needed to complete the scan. And so adding any additional light can cause glares or unclear images. The third thing is moisture control. And I think this is really important just because anytime that there's saliva or even, blood, when you get into the restorative scanning, you really want to make sure that there's nothing contaminating the area that you're scanning. So moisture control, very important. Some clinicians prefer to use an air water syringe with suction before and during scanning to keep the teeth and gums dry. If you are using that air water syringe, best practice would be to use that between scan segments. So maybe you start off, you got your lower arch, then you move to upper, then you move to the bite. You may have to stop and do the air water syringe between those segments. One other thing that I have found clinicians may like this method a little better, or maybe you do a combination of both, but just keeping some 2x2s nearby as you're scanning, just for a quick dry of that arch. That way, if you are scanning, you could just quickly grab it, try to dry off the arch before you continue moving on and completing your scan. So super important, 3 tips just to prepare you for success, and super important to remember when you're getting set up. Proper positioning of the scanner. So I wanted to just highlight this. I do think this is really important, as again, making sure that your scanner is positioned correctly, where you're not bending your neck, making it hard for you to actually look at the screen while you're scanning. So these images I really like, because as you can see, you've got the operator behind the patient. Patient is supine in the chair, and the scanner is just off to her side. So when I say in front of you, it could just be off to the side. However, you can see that viewfinder. So with the iTero, this little viewfinder is extremely important for you to watch while you scan. And then this other picture just gives you another angle from over top of that patient of what that might look like. Keeping your arms down by your side. As you see, she's not lifting her arms, she's keeping them down by her side, just to make sure her arms aren't going to tire out while she's scanning, things like that. So super important for positioning. Next, we're just going to cover just some quick software tips and walk through the home screen of the iTero scanner. It's extremely important that whatever platform you're using, you understand the software applications, the icons, what they're used for, and what they mean. So going through the iTero, we're going to talk about these icons up at the top. These are called your utility icons. And obviously some of them are pretty self-explanatory. Like this first icon is your battery. This next icon that I just highlighted in the red square, this is the learning cap. So what this icon does is, if you click on here, you actually have access to references, scanning references right from your scanner. I know a lot of times you guys are busy. These scanners are moving between operatories. So just if you ever have any downtime, I would highly recommend clicking on that icon. If you do have new dental assistants or hygienists that have joined the practice, you can click in and, again, review some references. I do believe there's some videos on there as well. So just good to know, good to have, and know what that is if you need anyone to access it. The lock screen is if you're going to lock the scanner, maybe you've stepped out the room and you don't want the patient clicking around in the scanner, you can lock that down. When you come back in, you just put back in your credentials and it will open the scanner back up. This is also used if you have multiple clinicians using the scanner. You can switch between users. So just great to have that and get in the habit of locking it down if you leave the operatory. The next icon is the settings. I do have a slide right after this that will walk through the settings just to make sure those are set up properly. You have everything on there that needs to be there in the settings. But before we do that, this little question mark, green question mark on your scanner, this is if you ever need to have iTero support remote into the scanner, or anyone remote into your scanner. You're going to click this icon, and then it's also going to pull up a headset. And that headset is where you'll get your TeamViewer credentials, and you'll give that to the person that's trying to get remoted in. Moving on to the main icon. So we'll cover this really quick and we'll get moving. So I like to typically train, new scan equals new patient. iTero has a new feature where, now it will recognize if you've tried to duplicate patient records. So that way you're not creating more than one of the same patient, things like that. So it will give you a highlight pop-up down at the bottom that says, hey, this is already an existing patient. Do you want to go ahead and load that patient? You can choose to do it that way. Or if you just use new scan for every new patient, you typically won't run into that unless you've got 2 patients with the same name. If you are looking for existing patients, they've already been to the practice, they've already been scanned, you'll go into your patients icon and search for the patient there. You'll go to their chart and you can start a new scan right basically from their chart in the iTero. Orders tab. So super important, because this is where all of your in progress or past orders are going to be stored. Now, past orders do end up cleaning out of the iTero itself. However, those past orders are stored in your myitero.com. So you'll see the most recent one stored down at the bottom, but it does filter out where they will remove from the actual scanner and they'll be stored in the cloud. But your in progress are very important, because if you're keeping a lot of in progress scans, with, maybe the patient came in, you guys had the RX already filled out, but then the patient, or you had the RX filled out, maybe the patient didn't actually show up. You want to make sure you delete that out, because over time it will eventually lead to a slowdown of your scanner, because you're keeping information on that scanner that doesn't need to be there, and just kind of bogging it down. So you want to make sure you clean out those in progress orders if you're not doing anything with the scan or the patient didn't show up. Now, one other important thing about orders is, as a lab here at Lexington Dental Lab Group, if we need to send back your scan, we can push it right back from our iTero portal and push it right back to you. It will show up in this orders tab. So if you ever have a scan sent back, when you click on orders, it will be sitting in your in progress, and the status of the order will say returned. So super important to check that daily and just make sure nothing's been returned from the lab. Now, typically we'll, reach out and call if there's something that we need, but still just get in the habit of checking the orders tab. Messages is just something that if there's any updates from a line or anything being pushed out, you just check messages. If you ever see a notification, I would just encourage you to check it. Typically, you're not going to have to check this often unless you see something there. So settings icon. I wanted to highlight settings because this is really important as you guys are scanning, and just making sure that the correct settings are set in your settings icon. So scanning position, obviously, as you saw in previous slides, we want to make sure we're behind the patient with the scanner positioned in front of us, or to a position where we're not turning our neck. So you don't want to change this to in front of the patient if you're scanning behind the patient. It does throw off the orientation, and you really want to make sure that's correct. Typically, I don't see offices change this to in front of the patient, so you probably never really have to worry about this one. And the orientation, again, this is already preset. So if you change it for any reason, just make sure it's set up with the way that you're actually scanning. The main important things here, though, is keeping your guidance hands checked, because if you actually, when we get to the live scan, I'll show you what that means. If you actually click do not show me again, this will disable the guidance hands. And the guidance hands on the iTero scanner are extremely important because, one, they walk you through the scan from start to finish with everything that the scanner wants you to capture in between segments. So it's really great if you've got, new assistants, new employees that are new to scanning. You may want to just leave those on for those that might not be as far, advanced in the practice. So keep those on, just simple click. The other thing that's important, and I really would prefer to see this order set in every iTero scanner, is when you're scanning for restorative. We're not going to cover restorative today, but just want to make sure this is checked in your settings. You want to make sure restorative prep order, you're going to do the prep first. The next is going to be the prep jaw, and then scan order. That is totally your preference. It is set to the lower jaw first. You can change it to the upper jaw. All that means is that if you're going to do a full arch scan like we're going to do today, if I had that set to the upper jaw, the scanner would just ask me to scan the upper jaw first versus the lower. So that's totally your preference, but the restorative order is important, and the guidance hence is very important to keep those engaged. So moving along, so how to upload images to your scan. So you guys have probably all seen the new update. There's a banner across the top of the RX. If it's still there, it basically says you can now upload any additional images into the same scan file. So if you're, taking any sort of shade images or anything that you want to show the lab as a reference point to the case that you are doing, you can now upload those with your scan, and they all come in the same file. This is really helpful for the lab because we then don't have to go into an email and look for, images. We can just pull it all right from the same file. So it makes it very convenient for everyone. So how to actually upload those images to the scan. So there's two ways you could do it. So oftentimes we'll work with offices and we'll let them know, hey, you can preload your RXs for the day. If you go into mytero.com, and if you already have images, maybe the patient's been before, or, maybe you already have those images, you could go and upload them right with the RX as you're preloading them. Or what you would have to do is you actually take the scan on the patient. You have to go to myitero.com. Under that patient's case, you will then upload those images, and then you have to go back to the scanner and send the file. You cannot send the file right from myitero.com. I know that is a bit of a harder workflow, and I think it's important to make sure that if you're going to do it like that and you're going to use this new feature, maybe you designate one person in the office that is responsible for checking the scanner at the beginning and end of every day, just to make sure you can clean out the in-progress scans or send off any scans that may have forgotten to be sent. So it is a new feature. It is convenient. But the workflow is a little bit more challenging, and you do have to take a couple additional steps to get these files uploaded. But great to have and good to know. If anyone has any questions on how to do this, there is a PDF that is on learniteroelement.com, and it will walk you through these exact steps. This is where I grabbed this image from. So it will walk you through exactly how to do that from the scanner, and then how to get them loaded in the myitero portal. And just really quick, this is what we see at the lab. So when you do add those photos, as you can see, it's right there with the prescription. It's right down below in attachments. And this is what the lab will see when you add those photos. So as you can see, these are shade matches, super helpful for us at the lab. And again, what used to happen for these specific doctors is they would send this via email, and then we would have to go get them from email, upload them with the file. This just obviously makes it convenient. Okay, before we get into some live scanning, now we're going to talk about some of the full arch procedure types that are available on your iTero. Study model iRecord, what they basically did when they rolled out the new RX is they combined 3 case types, as you can see up here. So Invisalign and iRecord and iCast, these were all combined into now what is study model / iRecord. This is really for, this is just really a record scan on a patient. So for any sort of hygiene scans, wellness scans, things like that, this is where you would want to scan that under. Now, in the next slide, if you're doing any sort of appliance or full arch scan on a patient for an appliance, you would want to make sure that you chart it under the appliance procedure type. So this is a brand new procedure. There was nothing to combine into this. This was created just to kind of streamline the RX. So if you were doing appliances like this, you no longer had to scan it under iRecord. It has a designation now, which makes it much easier for the lab. But things like a bite splint, night guards, mouth guards, whitening trays, Essex retainers, things of that nature is where you would want to scan your appliances under. And we'll get into that when we do our live scan as well too. So the scan pattern for iTero, and for most find, you typically do an occlusal lingual buccal strategy. It's important to know that if you are using a different platform, just make sure that you know the scan pattern that the scanner is recommending you do. I know, for instance, the Trios does have an occlusal lingual buccal strategy on the lower and an occlusal buccal lingual on the upper. So just make sure that if you're using another platform, you do know what it's recommending. But speaking on iTero, it is lingual buccal for both upper and for lower. As you can see, when you get on the lower, or even on the buccal sides, on the upper and the lower, excuse me, you do want to make sure that you're going posterior, so this distal molar to the midline, and then coming to the opposite side, doing distal molar to the midline. Scanner works from posterior to midline. So you want to make sure that as you're on the buccal, you're not trying to do the whole buccal arch in one swoop. You do want to split it up at that midline, and we're posterior to midline. So to talk about some angles and what that might look like, iTero is one in which you do want to be flat on the teeth, touching like a toothbrush. So when you're on the occlusal of the arch, You do want to make sure you're doing somewhat of a U shape or a box, if you will. Some people prefer a U, some people prefer a box. But this is going to help you capture a solid occlusal surface and even some of that lingual, so that when you go to dip into the lingual, you're holding the wand at a vertical angle, but the wand has already seen some of that lingual surface. So it's going to help you stitch that just much better and not allow the scanner to kind of stop, because the scanner is going to stop if it hasn't seen a part of the tissue or the teeth before. So it's going, you'll notice that it will stop. So this will be just a good strategy to make sure that you're already kind of dipping into that lingual as you're doing a U shape or a box. And then on the buckle, you do want to make sure that that wand is horizontal, still flat on the teeth, touching the teeth like a toothbrush. Super important as you're going around that buckle side. And we'll cover some of this. I'm going to run through these quickly, but we'll cover some of these as we're doing the live scan. So just some of the wand tip angles, again, flat on the teeth like a toothbrush. While on the upper, the cable end should be pointing towards the patient's nose, as you'll see if the patient's laying in the chair. I'm going to try to hold this up as best as I can. When I scan my Typodon, I do try to act like the patient is laying, but you want to make sure my wand and the cordon as I'm scanning would be pointed upwards towards that patient's nose as I'm flat on the occlusal. And then as I'm on the lower, cable end will be pointed toward the toes. So again, dipping into the lingual when you're on that occlusal surface and drawing somewhat of a box or a U shape. The lingual surface, so you do want to make sure as you're doing your occlusal lingual buckle that you keep the wand on. So after we've done our occlusal, we're going to dip into our lingual, and the wand is going to be vertical, and I'm just going to do a vertical swoop around that lingual in a continuous motion. I'm not breaking it up at the midline. That is only on the buccal surfaces. So lingual is a full swoop around that arch in a continuous motion. When you get closer toward those anteriors, you're going to have to do a bit of a twisting motion with your wrist just to kind of help you pass through that anterior section on the lingual side. And then the wand will be perpendicular to the teeth and should appear vertical in your viewfinder on the left-hand corner of your iTero. So the buccal surface, again, you're still going to leave your wand on. Now we've done our lingual, we're going to roll to our buccal. The big thing with iTero is when you're starting when you're showing the wand a new section of the mouth it has not seen before, you do want to roll you're going to roll back up to the occlusal once you get done with the lingual. You want to roll slowly to the buccal side and let the scanner just sit for a second. It'll allow the scanner to, pick up that area that it has not seen, and it'll allow for a better stitching and let the scanner recognize so you can continue your buccal strategy. So horizontal, again, super important when you're on the buccal sides, whether it's the upper or the lower, you work posterior to midline. Once you're done with your buccal scan, it's important that you're going to stitch your incisal edge. So you want to make sure your buccal and your lingual surface is stitched. You're going to perform a roll over those incisal edges. Moving on to the bite. Capturing the bite is, obviously if you're doing a full arch, you want to make sure if you cross that midline, you're capturing a bite on both sides of the arch. Super important that when you go to capture the bite, number one, sit your patient up in the chair. I work with a lot of offices that typically keep the patient laid back. And I find that if you sit the patient up, it allows them to truly bite naturally. And you're going to get a better scan if they're sitting up in the chair. Again, cross that midline, bite on both sides. But what's important about the bite is you don't have to go all the way posterior to this third molar. You can take the bite in the premolars. You just don't want to go past the canines. You really want to make sure that if you start the bite in the premolars, you really don't want to do a full zigzag up to the canines. So this is another tip. When you're going to do the bite, you're going to start the scanner once you're in place. And once that scanner recognizes where it is, I typically tell offices to hold for 1 banana. I know that sounds funny, but just say 1 banana in your head. You don't have to say it out loud because the patient's probably going to say, well, what does 1 banana mean, right? But just start the scanner, let it hold for a second, and then move up one tooth tissue, down one tooth and tissue. And I'll show you guys this here in just 1 second. That will allow the bite to pop in quicker, and you don't have to do such a zigzag motion to get that bite to pop in. So let's just talk about what makes a perfect full arch scan, and then we're going to cover some tips, and then we're going to dive right into a live scan. So solid distal wall. This is important because if you're doing any sort of appliance, we want to make sure that we capture the distal wall of that terminal molar. So that way the appliance can, the appliance can be made to fully fit over that arch. At least 2 millimeters of gum tissue is required. If you could capture 3 to 4 or however much tissue you can capture, certainly does help the lab out, especially if when you get into partials, or if you're doing any sort of sleep appliance or anything that would typically cover more gum tissue. The more you can give us, the better. You definitely want to make sure that as you do your occlusal lingual buccal scan path, you want to make sure you're not missing any data. So what that looks like is typically that dark blue that will show up once you do your first pass, you cut your scanner off. It will highlight in a blue color what you missed. There is a fill tool on the iTero that we can use to fill in that data. Now, if we missed a lot of data, we're going to have to use a different technique to go in and add more data to the scan, which I'll show you guys that again here in a second. But just important to know you don't want to have any missing information, especially for appliances. You also want to make sure you have a solid incisal edge. Again, rolling over those incisals to stitch that lingual and buccal. You want to make sure you have that because if you are doing an appliance, if you don't have an accurate scan of the incisal edge, you may find that the appliance doesn't necessarily fit over top of the arch. And then a solid bite on both sides of the arch if you cross that midline. And for a full arch scan, you are, so that's important. So a few tips, and then I'm going to be switching my screen to the iTero. So you really only want to turn the wand off in between segments, not while scanning. So again, I want to complete a full occlusal lingual scan path, turn it off, assess what I missed, use any sort of tools to fill in data or use a technique to add more data to my arch if needed. But I don't want to be turning it off if I scan the occlusion. I don't want to turn it off before I go to the lingual, and I don't want to turn it off before I go to the buccal. I want to keep it on the whole time. Again, flat to the teeth, touching like a toothbrush. Some other iOS platforms will request you to hover. And you want to just make sure that you know what your iOS platform requirements are. With the iTero though, once you start, let me back up really quick. With the iTero, you really do not want to start the scanner until you have your scanner positioned flat to scan. If the scanner is within focal depth and you start that scanner, it will capture, it will start to capture images. So the iTero has a 13 millimeter focal depth. So if you start the scanner and you're within that 13 millimeter focal depth, it will start taking images. And the image might not be as accurate as accurate as it would have been if you were flat on the tooth in position, ready to scan. So you really just want to be avoid overscanning, but I do just want to highlight what overscanning means. Overscanning is when your patient's environment is changing and you are just consistently scanning that area. So if I'm working on a prep, for instance, which we'll be doing in the next series, we'll be doing crown and bridge and the restorative workflow. But if I'm doing a prep and I'm spending over 10 seconds scanning that prep, I'm now working against the patient's environment, meaning saliva is now occurring, blood is creeping up, things are changing as I'm scanning. The first image I took of that scan was clean and crisp. That prep, was ready to be scanned. There was no saliva, no blood. But as over time, the time changes, now I've got saliva, which now I'm compiling a clean image with what I started with, then a dirty image. And so the image can start to get distorted. That is what the overscanning means. Sit the patient up to 45 degrees when capturing the bite. We covered that. And then just a strategy of holding for one banana. while the scanner recognizes where it is in the mouth, and then up one tooth tissue, down one tooth tissue. All right, so now I am going to switch my screens, so just give me a second.
While you're
And-
switching over, Tori, there's no questions in the chat,
Okay.
but if anybody has questions, very good information. So if you guys have any question while she's switching over, which you're too fast.
I had it
Not
ready.
enough.
Yes, we do have a smaller group, guys. So if anybody does have any questions, just certainly feel free. Alyssa, I don't know if they can come off mute, but
Okay, I can actually go ahead and do that. We do have a smaller group, so I'm
Yeah.
gonna, I'll make it so you all are allowed to talk. So if you can, if you're not speaking and you're somewhere that might be kind of loud, just throw yourself back on mute. But if you guys have questions, you should be able to chime in. You can certainly raise your hand as well, whatever works easiest, but feel free to chime in with any questions, comments.
Awesome, thank you. Okay, so as you guys know, we do utilize these scanners for actual patients. So today I'm actually showing you a demo in the iTero demo mode. So you'll see that the screen looks a little different. So I did just want to highlight that. You'll see the screen is striped in the background. So it's not just that solid blue color. And that's how you know you're in demo mode. You really do not want to, you really want to make sure if you ever click on demo mode, I'm just going to highlight this too, that you don't try to scan patients in demo mode because you will not be able to send the scan. So make sure you always get out of that. If you were practicing, whatever the case may be, just make sure you click out of that. We're going to dive into the new scan. So for this specific instance, I am just going to use the new scan because I don't want it to pull up any patient data. So just going to put in my name. It is important if you guys have the patient's date of birth, which I'll tell you how old I am, guys. Then also too, if you want to put the gender in here, certainly can do so. And then chart number, if you have a chart number for that patient already in your management system, you can add that in here just to keep things consistent. But I really do recommend if you don't do the chart number, I recommend doing something to differentiate your patients if you ever had another Tori McCraw walk through the door. And if you do, let me know because I'd love to meet her. But anyway, just make sure you have a way to differentiate between patients. The next thing I'm going to move into is my procedure type. So again, as you guys can see, we talked about the study model iRecord. If you are an Invisalign practice, you likely have Invisalign, the Vivera on here, and that is for your Invisalign scans. Now, if you don't have this on your scanner, you can submit Invisalign scans through the study model iRecord, as you can see here. Are available. All study model iRecord scans can be sent for Invisalign. But for today, I am going to do the appliance tab. Or appliance procedure. So I'm going to select appliance. The next thing I'm going to select is what am I doing? Am I doing a night guard, bite splint, sports mouth guard, sleep appliance, or ortho appliance? The one thing I do want to just make sure I highlight is if you do click on night guard, at Lexier, we have a couple different types of night guard, if you will. So if you just select night guard, but you don't tell us which specific product you want out of that category, it will delay the case. We'll have to call and just clarify because we don't want to proceed without knowing, do you want a Lexi Flexi? Do you want a hard soft night guard? Do you want a hard night guard? You know, what specifically are you looking for? You do need to put that in the notes. Going back over to the order though, obviously your due date, you can now select your due date, whereas previously iTero would pre-populate it for you and it would be 2 weeks out. I still recommend doing the 2 weeks out because obviously you do want to make sure that the date you select is still within Lexier's turnaround time. But I would just say 2 weeks is probably just a good rule of thumb to select for that, unless you've spoken to the lab and the lab, you know, you guys have a rush agreement settled and you want to put that date that, you know, you and the lab agreed upon, you can put that as well. Since we're in demo mode, it does not allow me to select a lab. So I'm just going to do my iTero.com account only. But in your scanner, you do have the ability to star your favorite labs. So I highly recommend doing that, so you're not having to scroll through that list. And obviously, I would highly recommend you start all of the Lexier labs. They do say the lab name -Lexier, so easy to find. If you are doing, depending on what we're doing now, today we're just doing a night guard, so I don't necessarily need to do the multi-bite feature, but you do have this option. If you're doing like a sleep apnea device, you do want to make sure that you select multi-bite, because we're going to need you to take the bite in a couple different angles. So we need a protrusive bite. All those things help us fabricate those appliances here at the lab. So you do have that feature, and it will just give you extra bite segments. I've already put my notes in, so I want a hard soft upper night guard. Anything else, you can add several notes to the lab now. They broke it up where this is already added, but if I wanted to just say, you know, another note to the lab, now it's added again. You could just go back in and edit the one that you first wrote. But if I could type, there we go. So now I can make an edit to that, and it will save if you just click anywhere on the screen. And apparently I didn't do my birthday right. So I did forget that this wants it in the day, the month, then the year. So sorry about that, guys. As you could see, it was red, so it wasn't good. It was signifying that I needed to fix that.
In your defense, iTero used to have it the other way.
It did. I was going to say that because I know I'm not crazy, because the other day when someone was doing it in front of me, I was like, no, type the month, then the date, then the year. But yeah, so
Yeah,
sorry about that. Okay, cool. So now I'm done with my prescription. So super important that I fill out everything with a red asterisk. But again, the more you can give to the lab, always going to be the better. So now we're going to move on to scan. And oftentimes I am at home on a home Wi-Fi. So if you see it just taking a little bit longer than normal, it's because, you know, obviously all of my Wi-Fi is connected to the same modem or router. So if you ever have this, if you have a lot of technology in your office, sometimes it might be recommended that you have like your modem, just so that way they're the only things operating off of that Wi-Fi. So just something to think about. Okay, so as you guys, that's my stool. I'm sorry, it looks really funny. That's not what it typically looks like. So as you guys can see, if you remember from my settings, I had my lower arch set as my preference. So the first thing my scanner is going to ask me for is my lower arch. Now, before I get started, I want to just highlight that when I flip through segments, I do not click on the arches themselves, right? I want to make sure that I follow these arrows right here, because as you can see, the first thing the scanner wants me to scan is the lower. The next thing the scanner is going to want me to scan is my upper, and then my bite. If you follow these arrows, it helps you not scan out of sequence. iTero really recommends that you scan within the recommended sequence so that everything stitches and merges properly. Now, you guys probably saw that my guidance hens didn't pop up. If you're familiar with the guidance hens, you will see that when you go to start your scanner, you'll have these guidance hens pop up. These tell me exactly how to scan, what the recommended strategy is, and actually, I mean, it walks you through the exact scans. If I were to hit "Don't show me again," then that disables the guidance hens, which again, you want to make sure if you have anybody in the office that needs these, you don't click that. But let's go ahead and get started on the scan for the arch. Now, the other thing I want to highlight too is you guys can see my lens is a little smudgy. I probably need to retire the scanner sleeve. I just use it for obviously this typodont. You guys are you know, using the disposables you dispose after every patient. Certainly hope that's the case, right? But you really don't want to have any smudges, or you want to make sure this is as clean as possible when you go to scan, especially when you're doing restorative. So on my lower, I'm on the distal molar. I am going to start my just a second, and then I'm going to do my occlusal. See how I'm dipping into my lingual with a box motion? Then I'm going to roll into my lingual. As I get to those anteriors, I'm doing a twisting motion with my hands, completing that lingual arch, rolling back to the occlusion of the molar I started with, and then rolling slowly to the buccal. Now, because the way my, you may find that the scanner will capture that buccal tissue just depending on patient's mouth. And it is hard to scan and talk. So just if I pause, just give me a second. I promise I'll say what I'm gonna say. But it just you may capture it by already kind of moving on your occlusal. But as you guys can see, I did distal molar to, I did my distal molar to my midline. I went posterior to the distal molar on the opposite side. And now I'm just gonna complete and do a roll of my incisal edges, just to make sure they stitched. I'm gonna come out the mouth. And I'm just gonna look at my arch, right? So did I get a solid distal wall? Yes. No missing information on that, on those terminal molars. Did I get enough gum tissue? This is pretty decent. I'm scanning a typodont that has a pretty like tough ridge on the bottom, but if I wanted to capture more information down over here, I'm gonna show you guys how to do that. But next I'm looking for, did I get a solid occlusal surface? Yes. Did I get a solid incisal edge? Not really. And I'm gonna show you guys what I mean by that. Can you see this like faint gray line going across the arch? This is and that I didn't stitch the two properly. So you do want to make sure you just kind of go back in and roll over those if possible. But the other thing I notice here too is that I'm missing some information. So obviously I know my model is prepped for an implant, and you'll see on the upper, it's got a bridge and a crown. But if this were to be a tooth and this were to be missing data, I'd want to go back in and fill this in. This part right here, it's not highlighted in that dark blue. So I'm not as necessarily worried about that. The scanner will likely fill that in for me, but I am going to hold my finger down and use my fill tool. And when you activate your fill tool, the fill tool basically is locking everything else in, but what is circled in red. And then just kind of tip over to capture that. It is highlighting this little area up here. So let's go ahead and hit that. And if it will let me grab this little piece up here. Awesome. So now everything should be captured, but before we move on, I want to show you guys the incisal edge roll, and then also adding a little bit of data to the gingiva on this side of Start my scanner. I'm going to let it pop in, recognize where it is in the mouth, and then I'm just going to roll and add a little bit of the gingiva. Okay. And now I do want to complete my incisal edge. So I'm just going to go back, roll that, and come. And as you guys can see, that line filled in quite a bit more. So it looks like the appropriate incisal edge for this arch. Again, that cord is going to be pointed towards the patient's nose, flat on the teeth like a toothbrush. I'll let it hold for a second. And now I'm going to do my occlusal. My lingual. It's a little challenging to twist sometimes, so you just got to make sure you got a good grip on the wand. And then I'm also going to roll, want to make sure I get that area back there, distal terminal, roll slowly to the buccal. And continue on that buccal as horizontal as I can be. May want to get a little bit more gingiva. And as I get right about here, I'm going to just roll over my incisal edges, come out. Go to the distal molar on the opposite side. Roll slowly. Coming around to my midline. And again, I want to make sure I complete a roll and stitch those surfaces. So I'm going to cut my skin. Same thing I'm reviewing here is, do I have enough gingiva around? Typically, we'd be pretty good. I could add a little bit more to this area right here I wanted. Do we have a solid distal wall? Yes. Do we have a solid occlusal surface? Yes. Are we missing some information? Yes. So I am going to use my fill tool. By holding my finger down, so now I just really want to get creative with my wand angles. You may have to there we go. Want to make sure that my incisal stitched properly. So I am going to go in and fill a little bit more information on the incisal. So I'm going to go back in and just kind of hit this area right here, but everything else looks good to me. Cutting my scanner on, let it recognizing what it's already scanned. See how it will pop in. And I don't want to spend too much time doing this because again, you don't want to image by adding more and more data. But as you guys can see, I was able to kind of stitch that image a little bit better. I should probably roll a little bit better over here, but you guys get the point as far as going in and getting things stitched properly. You don't want to spend too much time, but you do want an accurate image of what you're trying to scan to the lab. So I'm going to move on to my bite because I do know we've got about 10 minutes left and I want to jump back into the scan review before we finish things up. So I am going to sit my patient up in the chair. I am going to place my scanner in the patient's mouth. Again, not going so far posterior because that's extremely uncomfortable for the patient. Just kind of right here in that premolar area. On banana. Going up one tooth tissue, down one tooth and tissue. See why she's not popping in. There we go. And just kind of holding in that area. The way that my model, like it's just kind of hard to go up because that spot's blocking me there. But just kind of getting more of the gingiva on each side will help you get that bite to pop in if it's not working with the one banana. Again, we cross the midline, so we're going to do a bite on both sides. Banana. And we're going to get tooth and tissue. And boom. It's quicker. So sometimes it just might be because it's not getting enough of that tissue. So you may just need to show it more tissue for it to pop in. But this will complete our full arch. So if we want to move along to the post-process. We can look at it in stone. We can look at it in color. Stone is really great to look to see if patients have any chips or recession. Really good to just kind of see more detail if you put it into that stone model. The other thing you're going to look at when you're doing your full arch scans or wellness scans is obviously your occlusogram. This is going to show you how the patient is occluding, if there's any sort of malocclusion. This helps you speak to those appliances like the night guards and things like that. And if the patient regularly comes to you, you hopefully have a couple scans on that patient. And if you've, told them, hey, you need a night guard and they're not buying into it, they don't think they need one, you can actually run a time lapse on their scans and it will show them, what the wear and tear looked like over time. And so maybe if showing them like this isn't enough, maybe that will be enough to get them to actually get that night guard at this time. And that's all you really need to do. You could, use these tools. It's not necessarily required. This is just to erase anything if you feel like you need to go back and rescan. And this is just to trim some things up before you send it to the lab. But the lab can actually do a lot of the trimming if it's an excess of data. But to be honest, you guys can never give us enough, the way I look at it, right? The more information, the better. So I am going to hop back to, I'm going to let the scanner cut off because it is pretty loud. Into the PowerPoint because I do want to finish up with some scans that we have actually received here at the lab. So I don't know why it won't get out of this. Hold on, guys, for me 1 second. There we go. Okay. So this is an actual scan we received here at the lab. It is a perfect full arch scan. You can see the image down at the bottom where I am rotating it, just to give you guys a 360 view of what that looks like. They got I think I just drew on it. They got a graded solid incisal edge, as you could see. All of the information is there, solid distal wall, plenty of gingiva, and solid occlusal surface. So this is what we would claim as a perfect scan. Moving along. So as far as pulling some scans that had some missing data, as you can see on this distal wall, they missed this terminal molar. It's super important because if we're fabricating an appliance, we really just want to make sure we've got an accurate scan. And as you can see from the first one, it's possible. And we want to make sure that we get as much as possible to give you the best restoration or appliance that we could possibly give. So super important to capture that distal wall. This was an interesting one, and I think this is just to kind of, talk to, you really need to communicate with us if there are things you don't want the lab to do. Like for instance, this is a third molar, so maybe they didn't want the night guard to cover the entire arch back to the distal molars. We certainly don't know because the RX asked us to please fabricate lower flexi night guard. So when we get something like that, we might just assume they want the whole arch. Versus having the night guard stop on these terminal molars, not those third molars. So just make sure that you're specific to the lab and you let us know exactly what you're trying to request. This one right here, again, that incisal edge stitching. So even just so far back as these lingual and buccal surfaces, I know a lot, obviously up here, you can see that gray line running across, but obviously if you see missing information too, you really need to make sure you stitch those surfaces together. So just wanted to bring this scan up. Again, if you are getting an appliance like a night guard or an Essex retainer or something you need to make sure fits, this could be an issue if you're not getting those incisal edges, but you're having some issues with the fit of appliances. This could potentially be something that is contributing to that. This one right here, again, just the gingival tissue. This is a big one because we really need to make sure we've got that captured, even in just this small amount of data. I mean, obviously the lab can do some our end, but that's not what you guys want as the clinician. You don't ever want us to guess or, have to, assume what's not there. So just make sure you're getting enough tissue as you're doing that full arch scan. We just would have needed them to cut the scanner back on right in this area, let the scanner stitch, and then just capture a little bit more of that tissue. Now, that's not the end of the world. I would much rather have this scan versus a scan like this or even this one. But it's still just important for that perfect full arch scan. And that's it for today, guys. If you want to take a screenshot of this slide, you certainly can. It has iTero technical support, Invisalign support. Hopefully you guys already have those numbers, but even to the myitero.com and then learniteroelement.com. So that is more training, more resources that you guys can utilize. And then of course, Emily and I are always here to help as well too. This is our contact info, so we'll make sure that everyone who attended today receives this and an email. But that is it for today. Does anybody, it looks like we might have lost some. I know it's during the lunch hour. So does anybody have any questions?
And feel free, you guys, you can either enter it in the chat or you can come off of mute. Or you can email Tori or Emily after. I don't see
Perfect.
anything coming through, so
Yeah.
that
Well,
was
awesome.
fantastic information, Tori. Thank you.
Good. Yeah, always happy to help. And if there's anything, if we could ever come in and do in-person training or do a virtual training just similar to what we did today, if you guys would like that, we're happy to maybe try and set up or coordinate anything that helps benefit you all in the office. So just let us know how we can help. And we appreciate everyone joining in today. So now hopefully you got some time back in your day to join to eat your lunch. So we'll let you go.
One last just thing I wanted to note is we are offering these monthly, so hopefully you were able to receive the flyer. We've added, if you didn't see it, we've added specific topics that Tori will be covering. So, you know, what you saw this week will not be the same as what she'll be showing next month. So take a look at that. I'll be sure to send that back out to any attendees as well. And hopefully you can catch us on the next one next month.
Perfect. Thank you.
Thanks,
Bye,
everyone.
everyone.
Everyone have a great afternoon. Thanks,
Thank
Tori.
you.
Bye.